Yeah, well, look, there's a number of different things that might trigger it. Sometimes it can be this steady buildup of demand on the visual system during the school years. Some people might find they just sort of get more performance related symptoms that they don't think is a vision problem. They just say, look, I'm not a reader and I didn't enjoy it. And so they didn't do it. And then the problem sits there below the surface. And then they go and get a job where, they might be on the tools for most of their career. And then they get a supervisor's role or a management role. And they're placed in a position where they're doing the kind of work that might trigger some more of those headaches. Binocular visual dysfunction can occur from mild brain injury, whiplash, concussions. So you may have some other events in your life that then result in a headache. So yeah, you kind of it can happen at every age is the short answer. Absolutely. So it depends on the task you're doing and what other sort of events have happened to you.
So let's say that I feel like there's something going wrong with the way I deal with my visual world. So I come to see you, and
Yeah.
and I say, Paul, there's something not quite right with my eyes. What questions would you ask me?
Yeah, so I gave an example with the headaches. It's we'll kind of get an idea of what tasks you do, what sort of devices are you using, understanding your study, your occupation, what's changed recently. Have you had any concussions in the last 6 months? Have you had any sort of illnesses or viruses? How clearly are you seeing distance and near? We'll ask questions of how often do you get headaches? How often do you find that you might get sore eyes, tired eyes, eye strain? How do you find yourself concentrating when you read? How often do you lose your place? How often do you use your finger to keep your place? And we can also get a bit of an insight into the things that your visual dysfunction might stop you from doing or make it less enjoyable. So we might ask questions about what you like to do and what you don't like to do, because in the background, sometimes the vision problem can kind of shape the activities that you prefer doing without you realizing. If you find something uncomfortable, then you unconsciously may sort of stop doing it and reading. So classic example. So I often meet adults where I'll say, did you find reading uncomfortable, something you didn't like doing when you were younger? And they go, how did you know? And it's like, well, you've got binocular visual dysfunction. And for a lot of people, it sits there since childhood. And often they'll just become reading avoiders without realizing it. We need to know about general history, visual history, like I said, and I think we covered, the illness and injury that might relate to it. So, concussions, whiplash, those sorts of things.
A lot of that sounds like it's kind of a subjective diagnosis. You're asking the patients to describe, how they feel. But I guess that there are some also objective tests and diagnostic approaches that you can take as well. So tell us about those.
Absolutely. So, most people who have had an eye exam are probably pretty familiar with the sight test, cover one eye, read the letters on the chart. And we're looking to see if you can get to 20/20, which is the imperial version. We call it 6/6 in Australia and other countries. That's often then related to whether you have a prescription or not. So we do the test, the machine behind me on the wall there, of finding out what's the lens that gets you the clearest distance vision. And then we have a whole bunch of eye health checks in terms of front of eye, interior eye, pressure, those sorts of things. So they're your classic kind of tests that most people would know about. Standard in our practice that all the optometrists do in our practice is a very comprehensive test of how you actually use your two eyes together. So we're very interested in the quality of your eye movements, how well your two eyes are working together. So that'll come under various names of vergence testing or convergence, divergence, or binocular vision. We want to look at how well you're able to, the flexibility of your focusing system. That's also called accommodation. So how easily do you adjust your focusing? And the important thing is that focusing has to occur and be coordinated with your binocular vision. So we're looking at how those two systems interrelate as well. We'll do tests of your ability to pick up fine 3D vision. We'll test whether your eyes are maybe suppressing or inhibiting some of the information, which is a sign that you're sort of under stress. And so that makes up a good part of a routine exam. And for the most part, between what we find out in your case history and those exams, we're able to sort of identify most binocular visual dysfunctions from that. We have a couple of other sort of more sort of advanced instruments that we might use if we start to kind of either just need to tease out some of the specifics a bit more, or if your symptoms are strongly indicating that you have some sort of binocular visual dysfunction, but you kind of getting through the regular tests in an okay fashion, because in the background someone can force their way through the tests and kind of pass the numbers. And so we have some other tests to try and sort of highlight where the problem might be.
How long does a typical session last for? It sounds like
First
you're
time we
doing a
see,
lot there.
yeah. So the first time we see somebody is a 45-minute exam. So if we're dealing with someone who's got maybe a more complex history, where there may be some other neurological events or signs. So someone who's had a concussion or a brain injury, or is suffering with static and visual snow, and so our staff will kind of triage it. So if it's one of those cases where it sounds like we need to spend a bit more time, then we will book an hour for that one. So a good part of the time we spend is, yes, we do ask a lot of questions, we do a lot of measurements, but it's also making sure we've got plenty of time to discuss and explain what we've found, go through the various alternatives of how we sort of manage it. And if you're dealing with people with concussion or brain injury, sometimes we just need to take measurements slowly, because the measurements we use, we need to kind of just gently go in and understand that maybe a measurement might trigger some symptoms. And so we just want to sort of go in carefully when we're dealing with some of these cases.
Right. So any new patient who comes into your practice, do you go through this process of just checking, maybe you have BVD? Do you ask like the questions and sort of just do that sort of quality of life check up front?
Yeah, so we have questionnaires as part of the entry in. So that has a symptom checklist. Depending on the case, we might use a sort of a scored quality of life questionnaire, and they call quality of life questionnaires because it recognises the impact that a vision problem has on your ability to do things outside just vision. But we do have a core part of what we consider a normal exam is measuring your binocular visual function. One of the quotes is, every patient every day. So every patient gets that test every day that we're practicing.
But if I've been a patient of yours for 10 years and I'm just coming in for my annual checkup, would I have to fill in one of those questionnaires to sort of like give you a hint that maybe something's occurred that would require different testing?
There are some occasions, but it's been a little while since we've seen one. Then we may redo some of those questionnaires. Someone who's a regular patient of practice, those consultations are a little shorter. We tend to go half an hour. But again, if there's something that the patient's been discussing with the staff on the phone and they identify that potentially we need to spend a bit more time, then we'll allocate more time. The often between our just verbal case history and also looking at their binocular vision findings, again, if something flags up and change, we can kind of go, hey, I've noticed something's changed here. And you can kind of deeper dive into kind of the case history. Most people will come in and mention that something's changed, particularly, if you've been seeing us for a while, then you kind of get educated on it's not just about seeing clearly. There's so much more to what's going on with your visual system than just the bottom line on a letter chart.
Yeah, that continual patient education and making people aware of the all of these different aspects of vision are certainly an important part of what you do there at Harmony Vision Care, aren't they?
Absolutely, and I've been able to pick up patients come in for their routine exam. I haven't seen them for a couple of years, and everything seems to be okay. And then I go, hey, this has changed, and what's been gone on? I went, oh, okay. Well, actually, no, I had a concussion 12 months ago, and you kind of go, okay, well, there it is. And they've kind of just got on with life, even though it's like, and then you start asking questions, oh, what's changed since then? Oh, I can't do this now. I find that, I used to be able to do an 8-hour day on the computer, and now I can only do a couple of hours. And so it opens up those conversations and an opportunity to get them hopefully back to what they used to be able to do.